We're here to have Dr. Sara Cody address the latest numbers of COVID and what is happening in our county. And without further ado, we will turn it over to Dr. Sara Cody.
Good afternoon, everyone. Always good to be with you. Today, I just wanted to give you an update on where we are with COVID, sort of like a weather report. I've promised that I would always keep you updated so that you could see what I'm seeing, and today is just one of those updates. So the top line that I want to share is that all metrics that we follow pretty much are all ticking up. So for example, our reported cases, and we know this is an underreport, but of the reported cases, what we're seeing now is similar to what we were seeing in mid-February, and it's more than what we were seeing at the height of the Delta surge. And similarly, when we look across all of our sewer sheds, we are also seeing an uptick. So for example, the San Jose sewer shed, which covers the majority of the population in Santa Clara County, the levels there are now more than twice what they were 2 weeks ago. They've been steadily climbing for about a month, and they're above what we saw at the height of Delta. Not surprisingly, we are also seeing a pretty significant uptick in reports of outbreaks from schools, work sites, and other congregate facilities. Many of them are related to social gatherings. It's spring, school is ending, and people are gathering, and COVID is spreading. And we're just beginning to see some early signs yet that this may be translating to an uptick in hospitalizations. And as you know, the variants that are circulating now spread much more easily than earlier variants in the pandemic. And in fact, even if you got Omicron during the Omicron surge, you can still get COVID again, unfortunately. Wanted to make sure that everyone understood that. So what to do? As always, for the very few folks in our county who've not yet been vaccinated, we still think that that's a good idea and encourage you to talk with your healthcare provider or someone you trust, and a vaccine is ready for you. It's still the best way to prevent hospitalization, severe illness, and even death from COVID. Keep your mask handy. The highest grade that you feel comfortable wearing, keep it handy and wear it whenever you're indoors, especially if it's crowded or not well ventilated. Break out those tests that you may have stockpiled and gotten free from the government. Use them if you think you've been exposed or if you develop symptoms. We all want to see each other and gather, and we are gathering. We are all gathering, there's no question. If possible, gather outdoors, or if it's inside, choose a space that has good ventilation. And finally, if you do get sick, seek treatment. There is treatment available. These are pills that you can take to prevent severe illness from COVID. Many people are eligible. And most pharmacies stock them. So talk to your provider. We're also encouraging providers to get up to date on these pills. And so if you do get infected, you can get treated. I want to say that even though these new variants spread so quickly, and it's getting increasingly difficult because of that to prevent infection, it's still worth preventing infection. That's because if you're sick, you're going to miss work, you're going to miss school, you might expose somebody else who's not going to do well with COVID, and if you get sick with COVID, you're at risk of long COVID, which you really don't want to get. So while it's difficult, I still want to emphasize that trying to prevent it in the first place is still a good idea. So in summary, I guess I would say 2.5 years in, we're not out of it yet. Everyone has done an amazing job, and every little bit helps. None of us are perfect. We are not going to be perfect all the time, but every little bit that you do will help you stay safe and help keep our community safe. Thank you.
We'll now take questions. We'll start with the Mercury News.
Yeah. Mm-hmm. Sure. So right now, we're just continuing to ask everyone to do their part. Every little bit helps. We have masks, testing, ventilation. And at this point, we don't have any plans to do anything apart from being aligned with the state with regards to mask requirement. As you remember, the state still strongly recommends masking indoors, and we still strongly recommend masking indoors. For hospitalizations, it's important to distinguish between hospitalized with COVID and hospitalized for COVID. Our dashboard shows hospitalizations with COVID, so that reflects both. That means that someone might be hospitalized for a surgery and then they test positive for COVID, but they didn't need to go into the hospital because they were so sick with it. And the combination of with and for is starting to move up, and you can just begin to see that. You can just see it on our dashboard. It's really just happened over the last several days. The hospitalized for COVID or due to COVID, much more complicated. We have a whole team of people who literally pick through the data, and we look at that once a week. So far, it's been pretty steady, but I do anticipate that it will. We will see an increase.
San Jose Spotlight?
Yes, what are you going to be doing to encourage people who are 15 and above to get their second booster shot?
Yes, second boosters are available to anyone over 50, and we really strongly recommend them for folks over 60. We've had a steady stream of those seeking second boosters. I wouldn't call it a surge in uptake, but we have had a steady uptake. So the data that I have now, of those 65 and up, almost 29% have gotten their second booster. And of those 50 to 64, just 15% have gotten their second booster to date. I'm not sure. That's an excellent question. I'm honestly not sure.
Yeah.
So I've certainly heard of friends and coworkers getting sick in
Mhm.
recent weeks.
Mm-hmm.
Many of them have been triple vaccinated, the initial 2 shots and a booster. If you're about 6 months out from your last shot, how protected are you? So kind of a question about vaccine effectiveness and durability the further out that you go.
Right. So 2 parts to your question. 1, the durability of vaccination and booster for prevention of severe illness and death seems to be holding and remarkably strong. That's the good news. The second answer to your question is each new variant that emerges, particularly the Omicron and then the subvariants of Omicron and the various flavors of Omicron, each new one, there seems to be one that gains a growth advantage over the one that came previous, and then the next one comes and it spreads even more easily. And so with each kind of step up this ladder of like ease of spread, the vaccine is less able to protect from infection. So it is still true that people who are vaccinated and boosted are less likely to get infected and less likely to spread, but with every successive variety of Omicron, that seems to be less.
So if
But,
your
and
hi- if
yeah,
your highest goal is to avoid infection, should you be getting a booster? I mean, like, what if you're
Right.
what if you're younger than 50 or you don't have a health issue? Are you eligible? Can you get
Right.
there to get it?
So this is where the layers of protection come in. Being vaccinated and boosted is absolutely the best way to prevent hospitalization and death, and I talked about it. And it does still reduce your chance of becoming infected in the first place. I can't give you a percent with the current variants that are circulating, but it does reduce your chance of being infected. But even if you're vaccinated and boosted, if you still need to, like, when the weather gets bad, and what I'm telling you is, the COVID weather is starting to look not so good. In addition to your raincoat, you should also use an umbrella. That kind of thing. So vaccination and boosting is the very critical foundation, but when COVID weather starts getting wild, you have to add on other layers. You have to mask indoors, you know, test when necessary, try to take things outside if you can. You know, people have to make trade-offs.
I have a quick question. At the beginning, the first booster, they
Mhm.
said that it might last for like 3 months.
Mhm.
Even my vaccination card said that it would expire 3 months in. Where I personally am about like 5 months in or so. When do you think? How long do you think
Mhm.
it will hold? Like that's enough that will be enough protection. And when do you think the next booster will be available for more than people with 50 or chronic diseases, essential?
Yeah. So the first booster, people who've had their first booster are eligible. Those 50 and up are eligible for a second booster after 4 months. We don't yet have a booster available for people under 50, and I can't give you a timeline on that. I don't know. They're still in trials, looking at the data. Yeah. Hopefully soon. And then the question as to what other boosters will we need, I think that's unknown. It's certainly been very complicated with, different ages becoming eligible at different times and on different schedules.
ABC?
You had spoken earlier about, recommending gathering in a well-ventilated space, possibly outdoors if you can do that. I know a lot of people I know are still avoiding gatherings altogether. You don't have a crystal ball, but as a doctor, how long do you think we're going to have to continue to take those kinds of measures? Is this just our future for forever, or is there some kind of silver lining you think that can maybe predict that, where we can just completely go back to normal without having to worry or fear?
Yeah, I don't have a crystal ball, but what I can share is I would guess that we will continue to see peaks and valleys. How often the peaks come and how high they are and how dangerous they are, we don't really know. We don't really know. I think that one thing to remember is that the conditions are present for new variants to emerge, and they could emerge really in any corner of the world. And certainly what we've experienced during this pandemic is that a problem in one corner of the world then spreads across the world. So in a way, I think it's maybe a adjustment in the way that we think about it. It is, I believe, something that we're going to be living with for quite some time. We can't completely ignore it, though, because it has wreaked havoc. We can't ignore it, but we also have to have balance and do those things that we enjoy doing. So that's why my message is: the pandemic is still here. We are seeing more activity, and so it is time to break out your mask and break out your tests and just be a bit more cautious than maybe you were a month ago.
NBC?
Dr. Cody, is there two questions? One, is there a threshold either with cases or hospitalizations where the county might consider stepping up and having a mask mandate again or other restrictions? And two, for people who've been waiting to get a booster or a second booster, to time it out with a surge that would maximize their protection, is this the moment they should get a booster?
I certainly don't recommend trying to time the pandemic, but I do recommend that if you're eligible for a booster, either first or second, and you haven't gotten it yet, go ahead and get your booster. Likewise, if you're eligible to be vaccinated and you haven't been vaccinated yet, go ahead and get vaccinated.
KPIX?
So, Dr. Cody, you have in the past described this as a race between the vaccine and the variant, or the pandemic of the unvaccinated. Do you still think that those ways of understanding the situation hold true, or have the variants just kind of, if not defeated the vaccine, outrun it a little bit?
You know, I think it's a dance between a virus and humans with a vaccine at the party. That's
New metaphor?
I don't know. The vaccines, when you think about how much the variants circulating now have changed from the original, to me, it's remarkable how well the vaccines are performing after all that change with the virus. It really is remarkable. So that's something to keep in mind.
Luke, final question from NBC.
Dr. Cody, I just wanted to follow up on this one more time with the ingredients amendment. Is there a threshold either for cases or hospitalizations where the county might consider, or the county might expect the state to consider increasing restrictions as it comes to masking or other precautions?
Right. I would say at this point in the pandemic, no one wants to issue restrictions. At the same time, we also know that we have to think about the whole community, and particularly people who are more vulnerable and need restrictions to protect them. What I want to happen is for everyone to just understand where we are and to understand that they are at risk because we've got a lot of virus circulating now and it's on its way up. So people need to take extra precautions and wear their mask indoors and be a bit more choosy about their gatherings, take them outside, test, etc.
Thank you everyone for being here. We'll now begin the portion of the program in